Hello, I welcome you all in the lecture series of memory, and as we were discussing about the memory disorders in the previous lecture, we discussed about the amnesia, the problem of amnesia, how it starts, the types of amnesia. In today's lecture, we are going to address different case studies related to amnesia, and we will understand little bit in detail what is really happening with these individuals, what is really happening with the memory, what is really happening when the memory formation is getting disrupted after the trauma of the brain. In previous lecture, we even discussed about the brain structures such as diencephalon, medial temporal lobe, adjacent areas of the medial temporal lobe, and their contribution in the memory formation. Now here the classical case study of Henry Molaison has provided a lot of insight to us to understand the nature of memory, particularly the formation of new memory. Henry Molaison, young individual, 27 years old, suffering from epilepsy. He was having difficulty in living a day-to-day activities. Because of his high number of epileptic seizures, it was very difficult for this individual to live a normal life. So he went and to the doctors, and doctors recommended him that one solution to this problem is lobotomy. Lobotomy that time was very popular, so they just recommended the only solution to reduce the number of seizures is lobotomy. And what we can do about it, we will just remove a small piece of brain from his piece of brain, and this will reduce the seizures. He will not be having any problem with these seizures. Doctors were correct. They performed a surgery and they removed a piece of brain, medial temporal lobe, including the hippocampus and the amygdala regions. Now after the removal of 8 centimeter brain region, the individual was fine, less number of epileptic seizures, he was able to execute the task. But as he recovered from the surgery, the new problem started to emerge. This new problem was that he became amnesic, severely amnesic of events. He was not able to form new information. Loss of information was there. Anything which he was encountering, experiencing in the reality, he was not able to form. Unlikely the previous information, he was having the preserved old information prior to the injury, but the new information got impaired. The old information was intact, but the new information got impaired. He was not able to consolidate, he was not able to store this information for the future reference. His inability to learn and retain any new information of facts and events gave us a lot of insight about the importance and relevance of these brain structures. The brain structures which were being removed from the HM's brain. The role of medial temporal lobe, the role of hippocampus, the role of amygdala. The connection and projection of these brain regions and these neural correlates give us an insight that how in the Henry Molaison case, or Henry Molaison was unable to form new memory. HM's personality, perception, intelligence, however, didn't change. It remained intact. So one more conclusion came from this, that the structures which were being removed surgically were only responsible in the storing of information and particularly storing of new information. So the type of amnesia which he was suffering with was anterograde amnesia. Now in anterograde amnesia, what we realized is that the retrograde, the information before the surgery was preserved, and the area which was being removed has nothing to do with the personality, nothing to do with the intelligence, nothing to do with his perception. He did not have problems even with the short term memory or learning new motor skill, but the information related to episodic memory was being more impaired or severely impaired than the semantic memory. His episodic memory was impaired more and leaving the semantic memory intact. He was unable to recall the current date, where he was living, what he had for the breakfast, or whom he may have met a few minutes earlier. His retention capacity, for how long he could be able to remember or store the information, 30 seconds. More than 30 seconds, it becomes challenging for him to preserve the information. So, he was suffering with anterograde amnesia. Now, in order to study the anterograde amnesia, there are certain drugs like benzodiazepines. It has shown that it can create an artificial amnesia, a temporary condition which resembles the amnesic syndrome. After taking the drug, the individual is unable to form new memory. Individual can have a conversation, individual can recollect information, retrieval is not intact, but the formation of new information is a challenge for these individuals. In many instances, an unlawful act has been even performed using this drug, benzodiazepines, and that is what people have understood, that the drug resembles the amnesic syndrome. In some experiments, people have used these drugs to understand the notion of amnesia, and in some cases, in order to give relief to the patients from anxiety or stress related disorders, benzodiazepine seems to have a beneficial role. However, transient amnesia is very common in these individuals. Many occasions people feel that they cannot recollect information, there is a loss of new memory formation is there, but this is very transient, very less period of time. Under this influence of these medication, they can converse normally and retrieve well learned information. There is no such problem with these individuals to recollect the information. They cannot encode new information, particularly into the episodic memory. Patients who develop transient amnesia following administration of benzodiazepines are unaware of their episodic memory deficit. They do not know that certain deficiency is there in their formation of memory. After the administration of this drug, individual is not capable or able to understand and being aware of that there is a memory deficit which has happened in that period. And that is why, as I mentioned, many unlawful act has been performed using the similar kind of drugs. This kind of transient amnesic episode or the episodic memory deficiency is known as anosognosia, the failure to become aware of cognitive deficit, where individual is not aware that he may be having a memory deficit under the influence of this drug administration. So, as we have been discussing in the previous lecture about the one form of amnesia, that was anterograde amnesia, today we will be talking about the retrograde amnesia. Now, we know that anterograde amnesia, when we were talking about it, we discussed the Henry Molaison case, where he was incapable to form new information. But what is happening with the information which is stored? Is there a condition, is there a case where the previous stored information becomes impaired, leaving the new memory formation intact, which means that you can easily form new information, but when the retrieval of previous information is there, we are failing. So as you can see in this cartoon, when the trauma point arises, the new information problem leads to the anterogate amnesia, but when the retrieval of information, preserved memory, recollection of preserved memory is there, failure of recollection is known as retrograde amnesia. More than that, what we have even seen in retrograde amnesia or even in the anterograde amnesia, a partial loss of memory is there just before the trauma. Just before the trauma, there is loss of information. Why? Because of the loss of trace consolidation. The trace consolidation get affected because of the trauma. Any traumatic event, it affects the trace consolidation. So when we are talking about the preserved memories, we are talking about the old memories, and this trace consolidation which is getting affected or influenced by the trauma, it could go up to 1 year. So individual may not be able to recollect information dating back to 1 year, even those individuals who are having anterograde amnesia. So this duration can go up to 1 year approximately. So they cannot recollect the information about the surgery. Now, but when we are talking about the retrograde amnesia, we are talking about this preserved memory, which is way older than 1 year. So it extends back to the particular point to the past. People with retrograde amnesia will have a period from their lives from which they cannot recall any specific events. They cannot recollect the information at all. When given an autobiographical quiz, all of their reported memories will come back from a different period of their life than the one which have the retrograde amnesia. Now, it is very important for us to understand that the preserved memories which we are talking about it, because it becomes independent of these structures. So, it does not depend on the brain structures. So, in the case of Henry Molaison, preserved memories were not dependent on the middle temporal lobe, hippocampus or amygdala, which was being removed. So, it was dependent on the other associated structures like frontal cortex, motor area, visual area, and many more areas, parietal area. So, once the memory structures was being removed, still Henry Molaison was able to recollect information, the information which has become independent of a structure. There is a very curious case of retrograde amnesia about the Clive Wearing. Now, Clive Wearing was a singer, piano player, conductor and a composer. He got also the fame because of he played the music, a British musician played the music in Princess Diana and Prince Charles' wedding. So he got fame from their wedding, and after that he was also known a well-known pianist. But the problem, what else he is known for, he is well known also for the interesting case on memory loss, amnesia. He was having a very disease or infection which was viral encephalitis. Because of this viral encephalitis, he got infected with the virus, and which affected his brain in such a way that he got retrograde amnesia, and also he was suffering from the anterograde amnesia. So it was very difficult. That is why it was a very curious case, because in Henry Molaison we understood that he was suffering from anterograde amnesia, but Wearing was suffering from both types of amnesia. So neither his past was okay, neither his future was okay. He was living only in the present, and even in living in the present, though he was maintaining a diary, his storage of information was less than 6 seconds, and he lived this with this disease, with disorder 30 years. So in 1985, when he contracted with the viral encephalitis disease, massive swelling of the brain happened, which damaged his medial temporal lobe and prefrontal lobes. Now we know, we have discussed in the previous lectures that hippocampus has dense projection to the amygdala, to the frontal cortex, and if the damage of these areas will happen, then the projections will be there, but they will not be having any input from these regions. So if this is the prefrontal cortex and this is the hippocampus and this is amygdala, then though the projection may be there, but if these areas are very unique, if these networks get broken, damaged, then the failure of memory loss or amnesia may emerge out, and that is exactly what is happening in these individuals. So here the damage happened in his medial temporal lobe and prefrontal lobes. Viering has severe anterogate amnesia, had not learned a single new thing about the world in 30 years. Where Henry Mollison was preparing a diary, a neuro-rehabilitation technique, a tool to preserve the information in documenting it. But with Viering, it was a little challenging. He also had severe retrograde amnesia, so he was not able to remember a single event from his past. So he was not able to recollect that he played music in the Princess Diana and Prince Charles' wedding. He lived in a perpetual present, only the present he was living in. His working memory maintained information for about 10 seconds. As I said, 6 seconds, roughly around 6 to 10 seconds, he was able to maintain the information, and after that everything is lost. It's like you have just opened the tap and your tank is empty again. You are filling and the tap is open. You are filling the water in the tank, but the tap is open. So there is no storage of water. Exactly, this is what was happening with the Cleves also. This process, where new memories are more affected by the retrograde amnesia than the older memories, is known as Ribet's law. Now, as we were talking about the Cleve, and as we discussed earlier about this aspect where the trauma has happened and this loss of memory is happening up to 1 year, this is known as Ribet's law. What is this Ribet's law? It's very simple. Trauma has occurred here, T. So this side is anterogate amnesia and this side is retrograde. What people observed is that when there is a trauma, the recent memory close to the trauma seems to be affected by the trauma itself. So this trace of memory is affected, didn't undergo consolidation. This has undergone consolidation from here onwards, but this has not undergone consolidation. So Ribet's law say new memories are more affected by retrograde amnesia than the older memories. So these memories, new memories, are more affected by the retrograde amnesia. Memory consolidation is disrupted in retrograde amnesia. So retrograde amnesia is interfered or disrupted the consolidation process of the memory. So the traces of memory which is undergoing consolidation got interfered or damaged by the retrograde amnesia. As a result, the new memories got unconsolidated, didn't got stored at all. And in this case, a well known case is the Trevor Rees Jones. Trevor Rees Jones is a bodyguard of Princess Diana's boyfriend, and here what, he was the only survivor in that car crash, severe car crash, where after the trauma, when he was being asked repeatedly what happened, how did it happen, he was not able to recollect the information of the incident and the time before the incident. Travis got saved in the car crash, but he demonstrated a unique form of amnesia, and this unique form of amnesia was that he was not able to recollect the information about the incident and about that period when the incident has occurred, a few minutes or few hours ago, but he was able to recollect information of that event, what happened, and after that event how they collectively went into the car and then being chased by the reporters. But then what happened, then he was not able to recollect. In some cases this retrograde period is somewhat longer, some days, even months, or it could go up approximately to 1 year also. As a person recovers from head trauma, provided no permanent damage to the brain, the retrograde period shrinks. Older memory returns first, followed by the more recent memories. Because older memories are being more preserved and it has become independent of memory structures. Because these older memories are independent of brain structures, so their projection slowly just come into light. But the more recent ones, their projection along with the regions got affected. When we talk about the brain regions in retrograde amnesia, the brain regions which are important are the diencephalon, the brainstem, which is sending information from the brain to the peripheral nervous system, frontal lobes, which is important for the central executive system, decision making, etc., medial temporal lobes. Now, what we understand is that the damage to the hippocampus may still preserve the memory, and people may be able to retrieve information, because in retrograde amnesia the previous information is lost, but if hippocampus is intact, still people may not be able to recollect information, because hippocampus is required for the initial formation of memory. So for the new formation of memory or for new memory, hippocampus is okay, but for old information the hippocampus is not necessarily required. Researchers have, but in that case researchers still believe that medial temporal lobe has a significant role here. Now, it is very important for us to understand that how amnesia can also come into existence. One, we were talking about the benzodiazepines and administration of this drug. The another part is the electroconvulsive shock therapy, which seems to be the effective treatment towards some neurological disorders such as depression. And in this case a person is being given a high amplitude of current, a strong electric shock is given to the head of the patient to short circuit the firing of the neurons. In the case of schizophrenia, in the case of depression, seems to be an effective treatment. What happens after repeated short circuiting your neural system, nervous system? You are creating retrograde amnesia. Person is not able to recollect information. person loses the information. High number of ECT, high amount of information loss is there. More and more ECT is given to an individual, more and more information loss is seen, particularly retrograde amnesia. New formation of memory information is not impaired at all. People seem to overcome the depression, but along with that they lose the information about the episodes. Here also semantic information seems to be less impaired with the ECT. It creates period of retrograde amnesia. In most cases it wears off once the sessions are complete, but usually remains intact for the ECT procedure itself. Some have speculated memory loss itself creates the improved mood. So when the ECT is given, when the information loss is happen, this is actually elevating the individual. This is elevating the mood of the individual because there is no information left there to bother him, to confuse him, to put him under stress, and patient can no longer recall what is depressing them so much. So ECT seems to be a very effective tool. However, the side effects are memory loss. Now, as we were discussing about the ECT, electroconvulsive shock therapy, there is another procedure where there is no loss of amnesia, but it improves the memory, and that may be interesting for some of you to look into, is the transcranial electrical stimulation. It is quite reverse of ECT. Here when we are giving the high amplitude of current, here we give low amplitude of current. And it seems that it has an beneficial effect over depression and many other neurological disorders without resulting into amnesia. Okay. So let me conclude what we studied in today's lecture. We discussed about the Henry Molaison case, which gave us lot of insight about the retrograde amnesia, why it is happening, the structures, the associated structures, how HM's personality, perception, intelligence remained intact after the lobotomy. We even discussed about the how artificially we can induce amnesia, that is benzodiazepines. Administration of this drug lead towards the transient retrograde amnesia for a period of time where retrieval of information is not impaired, but formation of the information is intact, is impaired. Retrograde amnesia, where we discussed about the retrieval of previous information is impaired because of the trauma, and we discussed the curious case of Clive Wearing, where he was suffering from retrograde and retrograde amnesia same time, severely impaired memory loss is there, living in a present. We even discussed about it that after the trauma, retrograde amnesia targets the recent memory and affects the trace consolidation of recent memory, that is Ribet's law. And then brain regions which are responsible for retrograde amnesia, frontal cortex, medial temporal lobe. And finally we discussed how electroconvulsive shock therapy, which is an effective treatment towards the depression etc., seems to result into amnesia. With this I will end today's lecture, and in next lecture we will continue our discussion on memory disorders. Thank you.